Hello, I'm Dr. Nicholas Colivas. I'm a professor of orthopedic surgery at the University of California in San Francisco, and I'm the director of our Center for Meniscus Preservation. Today I'm going to be presenting a case, an illustrative case of a medial meniscus root tear. And the patient is a 63-year-old female who is quite active, loves to garden, she walks, she plays tennis, and she sustained a mild, not very dramatic twisting injury to her right knee approximately 6 weeks prior to presenting to us. She had some pain and swelling at the time, which initially was actually quite severe, and she was limping, but that sort of improved over time, and now on presentation was rather low grade, and she directed mostly posterior and medial type pain. Her examination showed a good range of motion and a stable knee with tenderness in the medial joint line and the typical meniscus tests positive. X-rays were largely unremarkable, though there is, if you can see this view here, some medial joint space narrowing, which is relatively common for these types of injuries. And imaging was ordered on the initial presentation due to the suspicion for a meniscus tear, specifically a medial meniscus tear, and specifically a medial root tear. Here you can see on the coronal the root has a separation, a gap there, and you can also see that scrolling through the coronal views, a significant amount of meniscus extrusion here. Looking at the sagittal, at the site of the root insertion of the medial meniscus, there's really just some synovial tissue. We call this the ghost sign, and I always look at the axials to be sure we're really looking at everything in here. This is one of the cases. It doesn't always happen on the axials, but this is one of the situations where you actually get a very clear view of a separation of the root there. So this lady went excuse me, to surgery, and this was her intraoperative findings. Here you can clearly see the root tear, the probes pulling on it. You can also see that there is some early changes in the femoral condyle. It's not perfect, so we typically would go ahead and debride this and get a nice fresh edge out of it using the shaver. Here it is probing it once we've done that, just to prove its mobility. We use a grasper to do that. Some of these that are more chronic sometimes don't move as nicely, and you don't correct the extrusion. So it's always good to test that and take a look at exactly what your tear looks like. We then use a suture passing device that will allow us to pass these racking type sutures, and we pass 2 of these. These are actually tape, not suture itself. They're 1.3 tape, which we think gives us a little additional strength, and we typically use 2, again, just to provide as much strength as possible. We then drill into the medial meniscus root insertion site, and once we have that drilled site, we actually prepare it quite extensively. We like to use the curette and the shaver to make sure we get a nice bleeding bony bed for this meniscus to sit back down and to heal onto. We strongly believe that this is a very important this is a very important part of the procedure, and very important for healing, which I think is the key to all of this, is to get that meniscus to heal back down onto that bony bed. You can certainly use a flip cutter to do that as well. We typically just use a curette and get that bony surface prepared. We then use a shuttling device to pass the sutures up the tunnel, and then shuttle our fiber tape sutures back down into the tunnel, and what that gets us is a nice secure fixation of the graft down onto that prepared surface with a double fixation there. We then tie that over a button and actually back that up with an anchor in the tibia to complete the process. Our post-op protocols for these is typically non-weight bearing for 4 weeks. We've gone from 6 weeks to 4 weeks, and we weight bear them in extension only for the next 2 weeks, and we do limit flexion to only 90 degrees for the first 6 weeks. This is the post-op view. Again, you can see the button that we use, and below that actually the anchor that we back that up with. There's no progression of her arthritis. This is about 6 months post-op. So she has done very well, has no pain, and returned to all of her activities at 6 months. Thank you for watching again this presentation on a medial meniscus root tear. Thank you.